we I'm currently recording this session so that um those who haven't or aren't here they can watch this later. So same instructions class like before. So after sa case problem, after nilabas sa case problem, the class will reread the case and then guess what the possible disorder that is there, and then if you're just ready, just simply raise your hand. Okay, so without further ado, okay, let's welcome group 8 as they will present anxiety and compulsive disorders. Okay, sige po.
So good morning everyone. We are group 8 where we are going to discuss anxiety and compulsive disorders. So the group members are Marcelino, Maghupoy, Manaay, and Madulid. So the case problem would be John is a 56 years old man who presents to you for a treatment. So his since symptoms started slowly, ginhambal niya nga he was always described as an anxious person and remembers being worried about a lot of things throughout his life. May mga time nga he was very afraid that nga maisip niya nga he'd have a contact nga makakontak siya makakuha siya sing HIV by just touching a doorknobs. Kag even though nga balaan niya nga irrational ini, aware siya nga irrational pero gaka-afraid siya gyapon nga mag-touch ang doorknob kay feeling niya makakontak siya sing HIV. So about 10 years ago, following a few life stressors, his anxiety and intrusive thoughts worsened significantly. So ara na sa point nga he began washing his hands excessively kag naka-develop na siya sing intense fear that someone would break his house and iya sala because he left something unlocked. So ara na siya sa point nga dapat limpyuhon niya gid iya hands kag ginabasol niya iya self if ever nga may masulod sa ila house kay wala iya na unlock ang ila door. I mean, wala iyan na lock iya door. So he stated that his fears led him to repeatedly check mga doors and windows before sleep in a specific order. So which was a source of contention with his wife. Also, hambal niya nga ang nagakulbaan siya nga makaubra mistake muna galid sa pag-slow sang iya work pati sa iya job. So checking many times to make sure nga wala mistake sa ginaubraya for which he gets reprimanded on occasion. Next please, Jer. Next slide, please. Thank you. So, John reports that his symptoms are getting worse. When I say worse, ara na sa point nga, for example, gapanghugas siya kamot, kag di siya maguntat hasta nga hindi iya ma-finish ang whole bar of soap sa iya nga hands. Ang iya hands ga-crack na because they are so dry kay hindi gid siya maguntat hasta hindi iya maubos ang soap sa panglimpyo lang sing iya kamot, which is why nag-push na siya for treatment. He says nga he continues to check the doors and window of his house na nga kapilagid ka beses, not just at night pero even sa day, and has on occasion driven home from work to be sure everything's really was locked. If he notices even a speck of dust on the floor, He states that he has the urge to clean the whole house and he often complies with that urge. So miskan gamay lang gid niya das makita iya sa floor, ilimpyuhan niya gid ang bilog nga balay, hindi lang ang amo na nga specific nga area. So John expresses significant distress over the symptoms as they are taking up more of his time and robbing him for his confidence as he is increasingly distracted at work and his family.
Okay, tapos yun nabasa ang case problem.
Yes, miss.
Okay, sige. So, kindly put it sa first slide para kabasa liwat ang classmates ninyo. Sige. So, kindly reread the slides and then internalize it and then think of what is the possible diagnosis in this case. Sige. I'll give you 3 to 4 minutes and if ready na ka mo to answer, just simply raise your hand. Okay? Sige. You may begin. Okay. Miss Yasay?
Good morning, ma'am. So I think, ma'am, the diagnosis is obsessive compulsive disorder
Okay, why do you think it's OCD or obsessive compulsive disorder?
because there is a presence of obsession, so that is seen sa anxiety and intrusive thoughts niya, and then compulsions by washing his hands excessively and by checking the doors and the windows repeatedly, miss.
Okay. Sige. Any more other uh who would like to add sa kay Miss Yasay?
Miss, may ara pagalit, miss.
Ay, sige, Miss.
So, sa diagnostic criteria B, miss, sa OCD, time-consuming pagid ang iya nga obsession or compulsion. So, sa case problem nga ini, it takes him long enough nga magwash sa iya hands to the point nga gusto niya ubuson ang bar soap.
Okay. Sige, next page sa kasi babasa pang others. Okay. Try to guess anong possible. Kasi may madugang. May madugang. Going once, going twice. Wala na may madugang. May third page pala sa dear ang inyong case problem.
Wala na, miss. Duwa lang
Oo.
siya, miss, ka page.
Okay, sige. Si Madugang. Kasi na-miss out si Miss Yasay. Gusto niyo idugang. Okay, sige. So, proceed na ta sa next.
So, John showed symptoms of obsessive compulsive disorder or OCD. And based on the criteria, he has the presence of obsessions, compulsions, or both, wherein obsessions, recurrent and persistent thoughts, urges, or images that are experienced and at some time during the disturbance is intrusive and unwanted, and that in most individuals cause marked anxiety or distress, and the individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action. And in John's case, his obsessions are fear of contracting HIV by touching doorknobs, an intense fear that someone would break into his house and it would be his fault because he left something unlocked, and his fear of making a mistake in his job. On the other hand, compulsions are repetitive behaviors or mental acts that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. The behaviors or mental acts are aimed at preventing or reducing anxiety or distress, or preventing some dreaded event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent, or are clearly excessive. So the compulsions of John are excessive hand washing, repetitive checking on doors and windows in a specific order, repetitive checking of work papers, and cleaning the whole house. Next slide, please. John also is qualified in the criteria that obsessions, compulsions are time-consuming or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, wherein he washes his hands until the whole soap bar is finished, which results to his cracked and dry hands. Checking of doors and windows is done numerous times throughout the day by driving home from work to make sure everything was locked. Work is turned in slowly due to repetitive checking, having the urge to clean the whole house after noticing a speck of dust on the floor. The obsessive compulsive symptoms are not attributable to the physiological effects of a substance or another medical condition, and in John's case, he was not reported to take any substance nor was diagnosed with another medical condition. And lastly, the disturbance is not better explained by the symptoms of another mental disorder. So the client shows signs of general anxiety disorder, but it was ruled out due to the presence of obsessions and compulsions. Kay ang disturbance is not better explained. So though bisan ka show siya sang signs sang God, may ara man siya gyapon obsessions kag compulsion. So nagsulod siya sa may OCD. So sa specification, may ara nga good and fair insight, wherein the individual recognizes that obsessive compulsive disorder beliefs are definitely or probably not true, that they may or may not be true. Kay si John, aware nga ang fear siya, irrational, kag gin-express siya nga pati siya man na stress nga ga-take up ang iya nga nahimo too much of his time and robbing him of his confidence, resulting in increased distractions at work and his family life.
So, we will proceed sa differential diagnosis kang aman nga case. So, first is ginruled out naman ang GAD as what said sa kaina lang. Yeah. So before that, we should always remember that in determining the differential diagnosis of in OCD, we should be reminded that OCD focuses on the obsession and compulsion. And also, we need to take note of having ritualistic behavior. Nga, for example, uh, I will not pass the test if hindi na kang sulod ang aking nga bag, hindi na kang pagsulod aking nga mga gamit bag in order 5 times do mga amo kri. So another is people having OCD will feel uneasy until everything looks right. So amo pagidra natin nga tandaan. And then, and lastly is time consuming. Okay, as said sa diagnostic. So first, even though ang pag-repetitive behavior ng mga tao nga may OCD, nagadepende man naga-vary man sa person nga na-diagnose sa OCD. So, let us proceed. So, GAD. So, GAD leans towards the forthcoming of intense fear that creates the worriedness of a person about his or her future. So, client is client is OCD because it focuses on the obsession and compulsion of the person that creates the fear in the future if not compiled to it. So sa aming nga case kang kay John, so for example if John could not check the doors and windows before going to sleep numerous times, if someone would then someone would break in and he will be responsible for that. So damot nga gin-roll out naman ang JAD because sa JAD nagasulod gid ang amang nga client sa diagnostic criteria A, sa letter A, sa B kag sa D, sa C kag sa D po. Pero nagalingit na sa obsessive compulsive disorder because gani ang amang nga client is my obsession and compulsion. Next, gin-rolled out man naman ang body dysmorphic disorder and trichotillomania or the hair pulling disorder. So body dysmorphic disorder is limited concerning about the appearance of a person. So John was only concerned with contamination rather than his appearance. So since John did not have any thoughts about his appearance, appearance having a problem, therefore body dysmorphic disorder is rolled out. So we should also look out for that. For example, kung may mga kulang sa sorry gid medyo sakit akan nga tatanlan. Next is trichotillomania. Trichotillomania is also ruled out because nga wala gani ti karado wala ti history si John about sa hair pulling disorder. Let us proceed sa hoard disorder. Hoarding disorder is also ruled out since John did not have any history of claims having hoarding disorder or difficulty in throwing away any possession. So let us also proceed sa tic and stereotypic disorder. So tic and stereotypic disorder are part of the neurodevelopmental disorder ni siya. So a tic disorder is a sudden, rapid, recurrent, non-rhythmic motor movement or vocalization. So in this case, John did not display such symptoms because since the start of John's anxiety and intrusive thoughts as at the age of 46. So remember nga ang client is 56 years old and ginpang share na ang kang last 10 years ago pa. So therefore 46 years old ang anak kang pag-start kang anxiety and intrusive thoughts. Therefore he did not meet the criteria for tic disorder. Next is stereotypic is ruled out also since there is an absence of obsession. Remember natin gid ang obsession and compulsion. Since since the onset is in the early developmental period, John did not qualify for that. So that is all for differential diagnosis.
So now let's move on to the biopsychosocial factors. So the list here are the factors which consider as a possible cause of having an OCD. So for the biological cause, first, the abnormal functioning in the limbic system. So children and adolescents with abnormal functioning in the limbic system may be particularly susceptible to feeling intensified fear and developing rigid thought and behavior. Next, the reaction of antigen with basal ganglia tissue due to infection. So there is an evidence about um, that a subset of children with OCD developed symptoms after an infection of group A beta hemolytic streptococcus or the strep throat. And next is regarding the familial transmission, wherein having parents or other family members with the disorder can increase the risk of developing OCD. Next, for the psychological causes, physical and sexual abuse in childhood and other stress or traumatic events have been associated with an increased risk for developing OCD. And for the personality, some people may develop the sudden onset of OCD symptoms due to a particular personality, such as being neat, meticulous, methodical people with high personal standards, as well as those who are generally quite anxious or have a very strong sense of responsibility for themselves and others. And lastly, reinforced behavior in attempt to reduce or avoid fear. So the intrusive thoughts, which cause distress, enables an individual to repeatedly engage in the behaviors associated with fear reduction. So it negatively reinforces this ritualized behavior. And lastly, for the social causes, reaction of parents to their child's behavior. So the way a family reacts to a child with OCD can affect the disorder because um, it can affect the worsens of the disorder because parents' reaction to their children's behavior can either increase or decrease the child's anxiety. So in John's case, wala siya na-mention na naka-experience siya sa mga traumatic events or naka-undergo siya siyang brain activity para ma-determine ang activities ang limbic system niya or na-infected siya sa strep throat. Wala man na-mention about his family history. However, some of his personal history na-mention sa my case. So, piskan wala siya na-mention sa case ni John, pwede tamang gyapon ma-infer ang biopsychosocial model to John's case. So the biological, psychological, and social causes can be determined through tests, interviews, and assessment. So kung i-base ta sa case ni John, we have no evidence to firmly state about the causes of his mental illness. However, ang biopsychosocial model, it encourages us to consider ang pag-use ng biological and psychological as well as the social principles para ma-address ang wellness and health ni John. So in this manner, we will consider the mentioned factors as the possible causes of this disorder. So for the biological causes, the imbalances or overactivity in John's internal body can possibly impede his ability to remain calm. It can be the reason why nag-persist sa iya ang obsession and compulsion. And for the psychological causes, how John views life, manages the accompanying stress, and coping with the anxiety can affect the worsen of his illness. So, John, di ba, yung describe sa case kagina, nga always siya kuno anxious. In fact, he is fearful of various things and because of this, na-develop ang iya anxiety. So, ang iya nga fear and intrusive thoughts nag-affect sa iya capability para i-manage ang iya nga disorder. Amo na siya nga naglalapagit. So, makita ni siya on how he repeatedly perform a pattern of behaviors as a coping mechanism para ma-reduce lang ang fear nga iya na feel the whole time biskan ang ina nga behavior wala man siya nagabulig pang reduce sang fear ya. And lastly, for the social causes, ma-focus lang kita sa workplace ni John kay amo lang na ang na-mention. So John's workplace seems one of the factors as to why he has a fear of making mistakes. So kung i-refer ta sa iya case, John gets reprimanded from time to time. So ang iya situation sa work possibly one of the factor nga lala ang iya nga condition. Therefore, it significantly affects his functionality.
Okay. Tapos na? Finish na kayo? Okay, thank you very much, Group 8 or presenting Group number 3 for your presentation. So, palakpakan ta sila, class. Okay? And, do you have any questions or something that you want to be clarified with when it comes our lesson for today? Module 6. The question or clarification. Okay. So, OCD, tandaan nyo liwat, ang OCD is, ang ilang it's an anxiety disorder. So, sang una, sa DSM-4 TR, ang anxiety, ang PTSD, kag ang trauma, sorry, not trauma, but OCD, under one categories na sila. So, they are known as anxiety disorders. Okay, but sa DSM-5, gin-separate na sila. So, si anxiety, si obsession and compulsive disorders, kag uh, si, si trauma, gin-separate na sila. So, tandaan nyo lang, again, for OCD, so, since it's an anxiety disorder, so there is what we call may worry, ginaya nga factor. May anxiousness siya nga gina-exhibit. And this anxiousness can be in the form of your obsessions. So when we say obsessions, these are what we call the mga intrusive thoughts, meaning hindi yan na makontrol sa mind niya. So it comes in sa mind niya all the time. Okay, and in order for the obsessions, kaya ang obsession siya nagahimo a worry, okay, so in order for it to calm down, so kailangan niya magdusang rituals or what they call compulsions. So tandaan nyo ha, ang obsessions more on sa mind and compulsions are more on sa behaviors. Okay, so I think damo-damo man types of obsessions. Okay? So may mga different themes man siya. So I think na ano ko siya na mention ko man sa inyong book. So yara nga prevention of harm from contamination. So imagine nyo na lang kung gaano kagrabe ang anxiety ng person yung may OCD sa nagka-pandemic. So, it's like their worst nightmare na nag-come true. Okay? So, may arap man nga prevention of harm from making a mistake. So, amo na ang do, they need to lock the doors. They also need to check kung napatay nila ang aircon, na-unplug ba, or na patay nila ang gas. Mayara man nga religious nga obsession, sexual thoughts nga, alam man nga intrusive. Mayara man intrusive thoughts of violence or aggression, and need for order and symmetry. So, those ka may need for order and symmetry, syempre sila na ang do makita mo gid nga gusto nila naka-align ng tanan. Napang separate nila for example ang mga sudan. So it's not what we call nga perfectionism. It's clearly different from it. So ang OCD, so it's more on anxiety siya para ma-reduce ang worry. So para ma-reduce ang worry, so you do compulsive behaviors. Okay, so unlike sa OCPD na more on siya sa perfectionism. Okay? So, ano pa yun ang pwede ko ma-discuss? So, any question, clarification that you would like me to answer? So, I think may ara man na-mention ang body dysmorphic disorder. So, under man siya sa obsessive and compulsive disorders. So, ang ilan naman niya, nga do obsession, okay, is preoccupied sila sa ilang body. So, ipangitat sila sang flaw, perceived flaw sa ilang body. Okay? So, that is non-existent or barely noticeable. Okay? So, sa may body dysmorphic disorder, so ang obsessions nila is more on sa napangitaan nila nga kung may, for example, kung ilang size, okay, kung hindi nila ma-maintain ang weight nila, okay, so amo lang ara sa ilang ulo or sa ilang mind. So, ara pagid nga ginatanaw nila basi may defects, okay? So, kung may defects man, perceived defects sila, they see it as a flaw. Okay? And, of course, since this is body dysmorphic disorder, so may ara sila sa ritualistic nga behavior such as looking at the mirror, trying to hide the body part, okay? Try sila compare sa ilang lawas sa others. And of course, in extreme cases, cosmetic surgery. So, So, may obsessions man ang body dysmorphic disorder, kag may compulsions man siya. Okay? So, obsessions of their body's flaw, okay? Or barely noticeable nga flaws, okay? So, in order for them to calm down those obsessions, so they often look sa mirror, or they try to compare their body to others, or they also try to do cosmetic surgery. Ano lang pinaka-extreme para maging perfect sila. Okay? So, that is the sad thing for body dysmorphic disorder. Okay? So, ang iba nga ni I think may comorbidity man ni siya nga may mga disorder. Siyempre since pakita nila ang self nila, for example, nga, ay hala, kailangan ko magpaniwang. Okay, so, sometimes sa sobra nila ka-obsession sa ilang lawas, sometimes they also develop or na pwede nga maging comorbidity siya sang eating disorder. Okay, so any more that you would like me to add? Okay, sige, just continue lang to watch my videos. So, at to complete naman to tandaan. And, so, when ganiin yung exam, yes, Miss Darulio, do you have any question?
Hello, ma'am. Good morning, ma'am. Ma'am, ask ko lang tani, ma'am. Like, ang example, bila mga anorexia nervosa, nga ni ma'am, mga bulimic, nga ni ma'am, madagdag na siya, ma'am, sa dysmorphic, ang body disorder, ma'am, or dysmorphic.
Hindi. It's another disorder. It's different. And like I said, under siya sa eating disorders, kaya may ara siya own nila nga category. But, like I said, pwede siya nga comorbidity. So, when we say comorbidity, butsiligon, pwede na siya ma-diagnose with your body dysmorphic disorder. Okay?
Okay, ma'am. Thank you.
Kay mi ara man na nga kumaga mamba ko nga hindi tanan nga may eating disorders, may body dysmorphic disorder. Same man na with body dysmorphic disorder, hindi man tanan nga may eating disorder. So it's depende sa presenting symptoms ng imo nga client or sa imo nga patient. Sige, questions pagit. Go lang. Sige, yes, Miss Yasay.
Miss, ask ko lang, Miss, ma-klase ka pa, Miss, next week, and then ano ang coverage, Miss, sa aton nga exam?
Wait lang. Ang next, ano bang natin? Wait lang ito. Full calendar. Sa calendar. Wala kita meeting next week. Ang next nga pa-present sa November 14 kag 16. So meaning mag-meet kita Tuesday kag Thursday sini. So trauma and dissociative disorders. So after midterms pa ang ato next meeting. Okay, so meaning may time ka mo to make it. And ang inyong nga inyong nga coverage is modules 1 to 6. I think nabutang ko na di. So just really focus on what you have learned so far, mga signs, symptoms. Aw lang ako niya do mahambalang coverage sa inyo. Okay, so for your abstract schedule, okay, so please listen carefully. So our date for your exam is November 9. Gabi, hapon siya. So 1, sa November 9, 2022, 5:30 to 7. Okay, so ang ano gani ST ano ka mo gani ano gani ka mo 7 to 8:30 TTH. Your proctor is si Prof. Pilien and EN 305 ang inyong room. Okay, so third floor. Again, site 3102, 1730 to 1900, so 5:30 to 7. And ang inyong proctor, si Prof. Pilien and EN305. Okay? So, any more question, clarification? So, 100 items ang exam and, yes, before I forgot. So, ano ang exam ta is, though may shading, so para do practice naman asa sa inyong board. So, please bring pencil na lang the examination. Okay, kay no erasure. So, kailangan nyo magdala sang pencil para ma-erase yung answer. Pero kung ballpen, syempre no erasure. Okay? So, ako na. So, pencil na may eraser, analo nyo. Okay, so any more question? Okay, so tuon mayo, medyo damo siya, pero like I said, ang video lecture Sara naman na better to watch it amat-amat rather than binge watching it. Trust me. Okay, so kung i-binge watch nyo, hindi wala magsunod ang information sa ulo ni. So, may app amat-amat. Okay? So, if wala naman lang question, so I'll just give out your attendance.